and welcome to this week's episode where we're talking about a very important women's health issue which is seen as taboo. I don't know why it's seen as taboo, because it affects 75% of women at least once in their lifetime, and it's thrush. So we're going to talk about it. I don't feel embarrassed, you don't feel embarrassed, and we're just going to inform ourselves. This is not intended to replace any kind of healthcare professional's advice, which you should always seek if you're concerned about any symptoms that you have, but it will inform us so that we do not get freaked out if we get these symptoms, and we know what to do. We know when we can safely self-diagnose and get products over the counter in a pharmacy, for example, or when we should probably see our GP about it. So let's just have a chat about it. So thrush, or vulvovaginal candidiasis, is an infection that most commonly affects women in the age range of about 25 to 35, and also disproportionately affects women who are pregnant, menopausal, or have certain underlying conditions such as diabetes. So when diabetes is not under, I suppose, its optimal control, it can lead to some conditions arising like thrush. Also if we are on certain medications, so we're going to go through all of that. So let's talk about the symptoms. So what are we looking out for when we think that we might have thrush? So the most common symptom that we look out for, and it doesn't by any means mean that it couldn't be any other condition, but a common symptom with thrush is an intense itching of the vagina. Also, something that we look out for is the thick white discharge, and it's often referred to as a cottage cheese-like discharge. I'm sorry if you like cottage cheese and I'm putting you off your food, but that is kind of what we do look out for. Also, it can be pain when you're urinating, pain during sex, and you're also looking for things like maybe some inflammation in the area. That can also be due to having scratched the area as well. It can make it kind of raw and red feeling, and just very, very uncomfortable. And people's symptoms will differ. Some people may not feel as intense an itch as others, and it's important to note as well that there's no smell associated with a vaginal yeast infection. If there was a smell, it would probably indicate another condition, and you'd need to go and visit your GP. These are the symptoms that we're looking out for with a vaginal yeast infection. It's also important to remember that some discharge is normal, that just because we have discharge doesn't necessarily mean that there's something wrong with our vagina. So the vagina is a self-cleaning part of our body, and it's incredible. It does all of its own work, which is exactly why we don't need to use douching or scented perfumed products or anything like that. It cleans itself, it really does. So when it comes to cleaning, all we're looking at really is just cleaning with water, maybe some plain unscented soap if you like, but really it's self-cleaning, just some water, and just frequently, I guess, like washing at least once a day, if not twice. So thrush is caused by a yeast called Candida albicans, and normally this exists in and around the vagina harmlessly because it's balanced out by a delicate balance of bacteria, yeast, that kind of thing in the vaginal area, and we have a specific kind of pH there that keeps everything in check. So if the natural pH balance is altered for any reason, and we'll go through those different reasons in a second, the yeast kind of has a chance to grow. It takes that opportunity to really thrive and expand, if you like. An interesting statistic, I suppose, is that infection with this Candida albicans and resulting thrush actually affects about 30% of women taking antibiotics. So really important to be aware of that if you are going on a course of antibiotics. It wipes out not only the bad bacteria, but also the good bacteria like lactobacillus, which normally exists in and around the vagina and keeps things kind of in check. When that's wiped out, we can get a bit of an imbalance and a resulting thrush infection. So it's Sunday, and my family are watching that, so that's what you just heard. Unfortunately for us women, when we go on antibiotics, it does put us at risk. I mentioned pregnancy and that being a risk factor for development of a yeast infection, and now if someone does develop a yeast infection during pregnancy, it is important that they have a chat with their GP and don't self-medicate. But basically the reason for that is because of the higher levels of estrogens present during pregnancy. We have a lot of hormone fluctuations, and the same is true of when we take oral contraceptives, particularly when they have a higher dose of estrogen. It can put us at risk of developing a yeast infection. So that is something to be mindful of as well, how medications can impact. Also conditions, I mentioned this a little bit earlier, but diabetic control is a really important factor. So if a woman presented to, say me, when I become a pharmacist with a yeast infection and she has diabetes, I would ask about her blood glucose control. So if she doesn't really have it quite under control, this can be a risk factor for developing a yeast infection, because they love a kind of sugary environment to develop. So the same is true if anyone without diabetes is eating a high sugar diet. We would recommend, you know, reducing your sugar intake to reduce your risk of recurring yeast infections, just because when we have too much sugar in the body, it can kind of leak out into our urine, and I suppose just create a perfect environment for these yeasts to grow and thrive. So we don't want to do that. So having your blood glucose under control if you're diabetic will be key to preventing those from happening. And also, this is like a warning sign, or alarm bells might be ringing if we see someone diabetic, that they may need to have kind of a check-in with their diabetic consultant or their GP, because it can be a giveaway, like a dead giveaway that their blood glucose is not under control, and that is risky. So a vaginal yeast infection is not considered an STI because infection can occur whether the person is sexually active or not. However, a high frequency of sexual intercourse is a risk factor for developing Candida albicans, or a yeast infection in the vagina. So I suppose that's something to be mindful of, and also having a new sexual partner as well, that can be a risk factor. So I mentioned douching earlier, and I'm so anti doing this just because the vagina is incredible self-cleaning, and there's absolutely no need to shove something up there just to clean it when it really does clean itself. It's incredible. So the same goes for scented bubble baths, bath salts, washes. They can really upset the natural pH balance of your vagina and give, I suppose, these what would normally be in check with bacteria and yeasts that exist in the vagina, it gives them a chance to thrive and just take over, and then we get those symptoms that we talked about earlier, and we don't want them. We don't want to give these guys a chance to grow. Another factor which hasn't specifically been scientifically proven but which may help is to reduce like wearing synthetic clothing, so to wear like, you know, breathable cotton underwear, and to avoid, I suppose, like tight synthetic clothing, or staying in your workout clothes, for example your leggings, for a while after your workout, just because it's a lovely warm moist environment and they love that to grow. So if we want to reduce the risk, that will be a good place to start as well. So these are all just tips to help prevent the infection, and to help, if you do have the infection, to prevent it from recurring, or to help it to heal as well. Just before we talk about the treatments, I just want to mention as well anything that lowers your I suppose your immune system's ability to fight for itself, like chemotherapy for example, really weakens your immune system, unfortunately, as does HIV or AIDS infection. So people with these conditions and taking these medications, we're really watching out for them. Not intended to replace your advice from a healthcare professional, but the treatments available are effective, and many of them are available over the counter. So over the counter we have a pessary which contains the antifungal drug clotrimazole, which basically is inserted using either an applicator or your finger, just to, I suppose, usually it's a single dose, a 500 milligram dose. You insert it at night time, you wake up in the morning, and there may be some remnants, but basically it does treat it, and you should expect it to start to clear up within a few days, and if not within 7 days, then you go and chat to your GP. There's also a cream, so you want to look at where the infection is. If you feel that it's inside your vagina, you'll need to use the pessary. If you feel that it's outside in the vulval area, the cream should suffice. If it's both areas, you could use the cream and the pessary. And those products are available over the counter, and if you chat to your pharmacist, they'll recommend something for you. If it's your first time having the infection though, it's best to chat to your GP. Your GP can also prescribe oral tablets which can help, and that will be a single dose of another antifungal called fluconazole, and that can help clear up the infection as well. If you have recurring yeast infections, so more than like 2 and 6 months, it will be good to chat to your GP as well. You know, we want to look into why it's happening and how we can prevent it from recurring, and just make sure there's no underlying condition there as well. So the point I'm trying to make there is that it's super treatable. There's options over the counter. If those aren't appropriate, you can chat to your GP and they can prescribe a regimen for you. It's important as well to remember that just looking after yourself and your overall health and well-being will prevent this from, you know, developing and recurring. And in terms of like reducing your stress in your lifestyle, getting enough sleep, that will all help to strengthen your immune system. People often ask for, you know, the best recommendation for the best vitamin for them, and honestly the best thing that anyone could recommend, healthcare professional or otherwise, is just to eat a healthy balanced diet, get enough sleep, reduce the stress in your life, because these can just cause so many different conditions, whether it's acute, i.e. in the short term, or chronic, long-term conditions. Stress, lack of sleep and poor diet contribute massively. So I'm always going to hammer that home with men, with women, everyone, that those are the best things you can do. Of course we can take like a multivitamin as like kind of an insurance policy that we're getting everything in that we need, but it shouldn't replace sleep, it shouldn't replace a balanced diet, and it shouldn't replace self-care, relaxing, taking time for yourself to recover and to rest and let your immune system be as strong as it can be. So I hope this was helpful. Of course, not intended to replace advice by a healthcare professional, but just to educate ourselves, to take the taboo out of it. It's super, super common. So I hope you found today's video useful, and that it will help to inform you if you do feel symptoms of a yeast infection, or your gal pal has symptoms of the infection, that you'll know what to advise them or to send them to this video. Of course, it's not intended to replace advice from your healthcare professional or your doctor, but it is just a little guide so we can recognise when we can self-treat and go to a pharmacy, or when we should probably just go straight on to our doctor. And it just takes the taboo out of it, because it's not a secret, it's not something that we should be ashamed about, it's not our fault. And yeah, we just need to continue to look after ourselves. Yeah, so basically the more we know and the less taboo these things are, the more we feel we can talk about them, and the less likely we are to suffer from more complicated infections because we're too afraid to ask anyone about it. And the more we can try and prevent these uncomfortable infections from happening. So I hope this was helpful, and I'll see you next week for another episode, and we'll cover some more women's health. So thanks and bye.